An evening to celebrate and recognize the best practices in Indian healthcare. We are back with our 9th edition of the much-awaited Healthcare Excellence Awards. Nominations in the category of patient safety hospitals are Aster Prime Hospital, Bardoli Satyagraha Hospital and CHC Bardoli, Fortis Escorts Heart Institute, Max Healthcare Institute Limited and Postgraduate Institute of Medical Education and Research, Chandigarh.
We invented the IV alert, which is based on a very simple principle of a spring balance. As the fluid drains, there's a decrease in the weight and this activates an alarm system. Till date, 5 lakh rupees have been spent on development of the prototype, on the in vivo in vitro testing, on the various exhibitions where we've shown it, and the project was started in January 2016.
Nominee in the category of patient centricity public hospital is Department of Health, Medical and Family Welfare and Government of Andhra Pradesh.
We have been implementing this innovation for past 1 year, more than a year actually. Last June we started. It's like in 67 tertiary care hospitals and it's fully functional as of now. This tool measures all 4 quality parameters which in the MOU, like the process quality, authentic quality and functional quality and technical quality.
Nominations in the category of patient centricity private hospital are Aster CMI, Dr. B.L. Kapoor Memorial Hospital, Dr. Ramesh Cardiac and Multi-Speciality Hospital Private Limited, Narayana Health, and Ruby Hall Clinic.
We designed this program and we established a command center and also hired resources such as care advocates who would go home to launch this program. So the primary objective of the program is to proactively identify the at-risk patients once they have been discharged, to ensure adherence to the care protocols and to make necessary or timely intervention in case the patient needs to be brought back to the system.
We have organized a program called 3 to 9, where we proactively look into the patient's condition starting from day 2 to 42 days post-discharge.
Nominations in the category of social initiative corporate are Fortis La Farm, iCure TechSoft Private Limited, and Max Bupa Health Insurance.
The Human Milk Bank has been something that's very close to my heart, something that I've been very passionate about, and we've been trying to start it for the last 5 to 10 years. And we managed to get the Milk Bank started and realize a dream last year. The concept of Milk Bank mainly arises from this need to feed preterm babies with breast milk.
Nominations in the category of social initiative not-for-profit are Hindustan Latex Family Planning Promotion Trust, Piramal Swasthya, Udan for the Disabled, H.M. Patel Center for Medical Care and Education, and Bhakti Vedanta Hospital and Research Institute, a project of Sri Chaitanya Seva Trust.
We thought that going out and doing community service is one initiative other than the healthcare facility that we have. We do have hub and spoke model, which I'll explain it a little later, home care for palliative and hospice services, rehabilitation for the youth as well. And it's a very interesting that the farmers, you might have been hearing about the farmer suicide. So from suicide to sweet side, more than 400 plus farmers have been rehabilitated. They have come out of the debt trap and they are doing organic farming. And women folks are having disposable surpluses for that as well.
Nominations in the category of preventive care are Maulana Azad Institute of Dental Sciences, Narayana Health, Seeds of Innocence, and Sir Gangaram Hospital.
We receive patients as well as patient samples from all over country, from all over India, as well as from the neighboring country. In addition to these services, we have also initiated many research projects that are related to prevention. Just to name a few, the first is to identify patients with long QT syndrome that can cause sudden death in families. Families where you have genetic hypercholesteremia to prevent early death due to cardiac diseases, and even non-invasive prenatal diagnosis for chromosomal disorders by examining the fetal DNA in the maternal blood.
Nominations in the category of skill development are Aster MedCity, Dr. B.L. Kapoor Memorial Hospital, Indraprastha Apollo Hospitals, and Bhakti Vedanta Hospital and Research Institute, a project of Sri Chaitanya Seva Trust.
In rains, we take shelter, and in need, there is a necessity to serve. That's how this initiative of skill development began. We never thought that there is such a huge requirement or potential. We genuinely wanted to serve because we have been conducting more than 400 plus camps in the tribal and rural areas. So we thought that why not we help the children who are coming to our camps.
Nominations in the category of health insurance products are Aditya Birla Health Insurance Company Limited, Cigna TTK Health Insurance, and Max Bupa Health Insurance.
large consumer segments in India, which is having diabetes, asthma, hypertension, high cholesterol, they are realizing that they actually no real meaningful product for them. Even if someone gives them with a waiting period restrictions, they actually, there are day-to-day expenses that they are incurring, there's nothing in it in the insurance product for them. So we brought down a product which has an element of chronic care management, where we say, if you have any of these 4 conditions, we'll give you a product which will cover all your expenses because of this, including hospitalization, without any waiting period, from day 1 coverage. And what it is fundamentally doing is, it is changing the nature of the category from a buy and forget to a buy and engage, and do something to start influencing consumer behavior to improve their health.
Nominations in the category of Healthcare Startup are Health Show Private Limited and Part Shodh Healthcare Private Limited.
So there are the two part of the this biosensor. One is the electronics, hardware and software, and other is the test strips. So our whole R&D lies on this test strip, because this is the known, this is known electronics. So however we designed the whole circuitry, this plastic, everything we designed ourselves in this startup, and we outsource this to for the scaling to a company in Mysore.
Nominee in the category of Medical Technology Devices is BPL Medical Technologies Private Limited.
The reason behind developing this idea was the fact that there are around 64 million cardiac patients in India, and most of the cardiac patients are diabetic as well. So even before we thought of developing a monitoring solution, we wanted to develop something that would address the needs of both the markets, both for cardiac patients and diabetic patients. And with respect to Indian healthcare, the problem with monitoring is the fact that most of the patients are lost to follow-ups.
Special Jury Award, Dr. K.R. Balakrishnan. With 39 years of experience in the field of medical sciences, Dr. K.R. Balakrishnan is associated with Fortis Malar Hospital as the Director of Cardiac Science, Chief Cardiothoracic and Transplant Surgeon. Having successfully performed over 200 transplant surgeries and 16,000 heart operations independently, Dr. K.R. Balakrishnan has been widely recognized in the medical fraternity as a pioneer in Indian cardiac care. At Fortis Malar Hospital, Chennai, he has performed 153 transplants, out of which 139 have been in the last 2 years. Dr. K.R. Balakrishnan has played a significant role in elevating the Indian medical practices on a global scale, and is the first surgeon in India to have completed over 150 successful heart transplants. He is a recipient of several recognitions and awards, including First Prize in Surgery 1976 by the Jawaharlal Institute of Postgraduate Medical Education and Research, Pondicherry, Hiralal Gold Medal in Surgery, awarded by the All India Institute of Medical Sciences, New Delhi, Double Helical National Health Award 2017 for pioneering work in heart transplant surgery in India. FICCI deeply acknowledges the outstanding contribution of Dr. K.R. Balakrishnan in the field of cardiac transplant in the country, and take immense pleasure in conferring the Special Jury Award to him. Healthcare Personality of the Year, Dr. Nandakumar Jairam. Dr. Nandakumar Jairam is a former professor and head of the Department of Surgery at St. John's Medical College Hospital, Bangalore. He has also served as Medical Director of Malia Hospital, Bangalore, where he was a consultant surgeon for many years. His expertise in colorectal surgery is acquired from Mayo Clinic, USA, and St. Mark's Hospital, London. Dr. Jairam has deep-rooted knowledge and understanding of the healthcare sector and has served the industry for over 40 years now. Dr. Jairam has practiced as a surgeon and held academic positions including being a professor of surgery and HOD at St. John's Medical College and Hospital. FICCI deeply appreciates the immense contribution and proven leadership of Dr. Jairam and takes immense pleasure in conferring the Healthcare Personality of the Year Award 2017 to him. Lifetime Achievement Award, Honorary Brigadier Dr. Arvind Lal. Honorary Brigadier Dr. Arvind Lal is a pioneer in bringing laboratory services in India at par with the Western world. He is an alumnus of the Armed Forces Medical College, EFMC Pune, having received his graduate and postgraduate medical degrees from the prestigious institute. Under his expert guidance and leadership, Dr. Lal Path Labs, LPL, has become one of the most reputed laboratories in Asia, having to its credit a record of 28 labs accredited from the National Accreditation Board for Testing and Calibration Laboratories, NABL, Ministry of Science and Technology, Government of India. Dr. Lal was appointed as the Honorary Physician to the President of India in 2001. He has also been serving as a pathologist to almost all the past and present presidents and prime ministers of India. He is also a recipient of several prestigious awards and has been honored with the Padma Shri. He is also the first civilian doctor to be granted an honorary brigadier's rank in Armed Forces Medical Services. In 2016, All India Management Association, AIMA, conferred on Dr. Lal the Entrepreneur of the Year Award. FICCI deeply acknowledges the contribution and proven leadership of Dr. Arvind Lal that has made him a role model and guide for many, and takes immense pleasure in conferring the Lifetime Achievement Award to him.